Over the years, numerous supplement companies have claimed that they have a natural cure for ADD, ADHD. These claims have proved to be absolutely baseless. Adcare does not make those claims, and the FDA would not allow those claims even if they were true, because they specifically state that natural products are not allowed to make claims for treating health disorders. Adcare does not cure ADD, and as yet nothing does, including stimulant medications. For many people, Adcare helps support and balance the neurotransmitters to such a degree that the symptoms consistent with ADD, ADHD are greatly diminished. Our research and client testimonials all point to better memory, concentration, less procrastination, and better impulse control. It is the only all-natural supplement that is able to do this effectively. There are distinct advantages that Adcare has over the stimulants. Adcare is 100% natural and is made from herbs, amino acids, and a proprietary homeopathic blend. There is absolutely no prescription necessary. There is no high or addictive component. It does not adversely affect sleep or appetite. Adcare may help reduce anger, obsessions, compulsions, and anxiety, and may also increase focus and alertness naturally. As a clinician, I am most concerned with what works. My goal is to have the greatest possible progress for my clients with the least amount of side effects when using either prescription medication or a natural supplement. My standard is 10% or less for side effects. Although 85% of my clients are now on Adcare natural supplements, I have no qualms at all about using medications if and when they are needed, and 15% of my clients do. Most of my clients have told me that Adcare is just as effective as the stimulants for both focusing and feeling alert, and they also notice feeling much more relaxed. The 15% that use the stimulants find Adcare slightly less effective with focusing and feeling alert, but also relate feeling more relaxed with Adcare. Most clients simply use Adcare instead of the stimulants, while some use the stimulants as their first dose and Adcare for their second or third. I even had some clients report using both a stimulant and Adcare together because they have noticed that Adcare lessens the side effects of the stimulants in many cases. I developed Adcare through a combination of observation, deduction, and applied kinesiology or muscle testing in 2006. Before Adcare, I had been specializing in clients with attention deficit disorder for 20 years. During that time, I had many people initially reject the diagnosis because of all the bad press ADD receives. Through the years, I also found many people who felt they had been helped by natural methods, although they still showed all the signs of ADD, and improvement was in reality quite minimal. Although the treatment of ADD for each client was different due to the 6 types of ADD, most clients were helped tremendously with long-acting Adderall twice a day at 20 to 30 milligrams. When there was depression or overfocused tendencies, Effexor 150 milligrams was used by me to good effect. When ADD treatment is successful, a client often improves by 200%, and many times their economic situation triples because of increased efficiency. After I formulated Adcare, I asked several of my clients who had good reactions to the stimulants to try the natural supplement on a weekend, either as a second or a third dose. Based upon their statements, I made slight alterations to the original formula, and most people felt they got the same amount of focus and alertness with even more relaxation than the stimulants. However, proof with applied kinesiology and client self-report was not enough, so we decided to perform clinical trials at the Amen Clinic with both the SPECT scans and the Conners ADD test. The results of those head-to-head tests with Adderall are presented below, followed by various testimonials and a detailed discussion of the Adcare product line. This is a surface brain scan of a 36-year-old male who had overfocused ADD and was stabilized on Adderall 20 milligrams twice a day and 75 milligrams of Effexor. This scan was taken the first day when the client was not on his stimulant medication. As you can see from this scan, there is the traditional depressed prefrontal cortex, as shown by the darkened areas that appear to be holes in the top part of the brain. This scan clearly shows the decreased electricity and blood flow in the prefrontal cortex that indicates attention deficit disorder. This is the same client's brain the next day and an hour and a half after taking 3 Adcare capsules. The results were truly amazing. On the left side of the screen, which is really the right side of the brain, the entire area has been restored to health. The brain is smooth and full, which denotes greater electricity and blood flow. The other side of the brain is about 90 to 95% fully restored. If you look at the entire brain compared to the first scan, the brain is much fuller and smoother in general. The third image is the Adderall scan and was taken the third day. We did this on purpose with all the scans to make sure that the stimulant had the edge. This means that any of the improvement from Adcare, which might generalize to the stimulant scan. We wanted to ensure that the Adcare scan was not helped by generalization from the stimulant. This third scan shows once again proper blood flow and electricity. Adderall even took away the small area that remained depressed with the natural supplement scan. Adcare performed 95% as well as the stimulant, which is an amazing feat for an entirely natural supplement. As discussed earlier, the Conners ADD test measures impulsive movements. The client is asked to hit the space bar on the computer for any letter that appears on the screen but X. Every time the client clicks X, it is counted as a mistake. The lower score is the better score. In this client's first Conners test, no medication, he missed 9. He missed 0 on both the Adcare test and the Adderall test. Thus, a totally natural supplement worked as well as stimulant medication for this important ADD test. The Conners test has been the accepted standard test for making a diagnosis of ADD for over 30 years. This is the surface brain scan of a 36-year-old woman who has overfocused ADD and was originally stabilized on Effexor 150 milligrams and Adderall 20 milligrams twice a day. She stopped her medication a few days before she took the scan. Once again, you can see the characteristic dark holes on either side of the prefrontal cortex, which indicate attention deficit disorder. This is the surface scan an hour and a half after the client had taken 2 Adcare capsules. On the left side of the screen, which is really the right side of the brain, Adcare brought back 85 to 90% full functioning. On the right side of the screen, just the left side of the brain, there was only moderate improvement. This scan is the Adderall scan. Adcare performed slightly better than Adderall on the left side of the screen, which is the right side of the brain, but Adderall did a significantly better job on the other side of the brain. This is an internal SPECT scan without medication. It looks imposing at first, but is relatively easy to read. Essentially, anything in the bottom area of the brain or cerebellum that appears white indicates dopamine activity, which is good. It might also be red or yellow. However, any other part of the brain that appears white, red, or yellow means that that section of the brain is working 15% hotter than it should. This brain shows good overall activity in the cerebellum at the bottom. However, the middle section is white. This means that the limbic system is running too hot, which would indicate that serotonin is too low. At the very top of the limbic system is the part of the brain called the cingulate system, which is the part of the brain that runs right down the middle of the two hemispheres of the brain from top to bottom. This part of the brain is also running hot. The basal ganglia are also white and overactive. These are above and to the right and left of the limbic system. The best overall scan would ideally be totally blue with white only in the cerebellum. The red areas are somewhat overactive, but not nearly as much as the white. Overall, this scan shows depression, irritability, obsessions, and what is known as the black diamond, which indicates PTSD or past trauma. This is the internal SPECT scan on the second day, an hour and a half after taking 2 Adcare. I was amazed when I saw this particular scan. It is a thing of beauty. As you see at the bottom of the screen, we added a tremendous amount of dopamine, as indicated by the white color, which essentially means that the brain would work quicker. Almost the entire middle and top areas of the brain are blue, indicating calm. This scan indicates that the totally natural homeopathic substance seemed to increase serotonin, dopamine, norepinephrine, acetylcholine, and GABA, in addition to activating the prefrontal cortex. This is when I realized that if we took the proprietary homeopathic blend and added St. John's wort, we might have a superior natural antidepressant. In fact, the proprietary homeopathic blend often seems to help with depressed feelings, obsessive thoughts, anxiety, and general memory. In the patent pending, we also listed Alzheimer's, multiple sclerosis, and autistic spectrum disorder as possible beneficiaries of Adcare. No specific research has been done in these areas, but increased dopamine has been shown to be beneficial, and Adcare is designed to increase dopamine. This is the same client scan a day later after she took Adderall. The Adderall was not as effective as the natural supplement in increasing dopamine in the cerebellum. In fact, it increased the problems in the cingulate system and limbic system. It decreased the basal ganglia in some areas and increased it in others. Adcare performed better in all of the internal areas of the brain, and this is usually the case. When this client took no medication, she missed 15.11 on the Conners ADD test. With Adcare, she missed 4.51 items, and with Adderall, she missed 10.67. The all-natural supplement Adcare simply trounced the stimulants in this test as well. This next series of surface SPECT scans are on a 58-year-old woman with a history of attention deficit disorder, irritability, and severe problems with menopause. In the scan, without medication, the basal ganglia and limbic system are inflamed, indicating depression and/or irritability and anxiety on her no medication scan. In addition, there is hardly any white area in the cerebellum, indicating an almost total lack of dopamine. The Adcare scan showed remarkable improvement. The red area on the top, which indicates a hot cingulate system, is now clear, and the basal ganglia have been reduced by a good 50%, although the limbic system seems to have increased a small amount. The most prominent part of the scan, however, is the amazing amount of dopamine that has been increased in the cerebellum. This is a remarkable amount of improvement and might help concentration and memory both from the symptoms of ADD and menopause. This particular scan is the one that convinced us that the proprietary homeopathic blend may help both general memory and menopausal symptoms. The Adderall scan was extremely interesting. The Adderall cleared the cingulate system as well as the Adcare did a better job on the basal ganglia on the left side of the screen, which would be the right basal ganglia, but did a very poor job on the right-hand side basal ganglia, which is really the left side of the brain. Adderall did a terrific job on the limbic system, but a very inadequate job on the main problem, which was the dopamine in the cerebellum. Adcare performed much better in this critical area. This is the no medication surface scan of a 44-year-old woman with overfocused ADD. She displays the typical ADD pattern of two depressed areas in the prefrontal cortex where the electricity and blood flow has decreased. It is not as deep as some of the scans we have seen, although her clinical symptoms were often even more severe than the other clients. This is the Adcare scan. The natural supplement has entirely cleared the prefrontal cortex, enabling the natural electricity and blood flow to come back into this area. This particular scan is especially pristine. This is the Adderall scan. Adderall did a terrific job on the left side of the picture, which would be the right prefrontal cortex. However, the right side of the image, or the left prefrontal cortex, still has a very large depressed area where the blood flow and electricity are impaired. This is the only scan to date where Adcare completely bested Adderall in the surface scan. Traditionally, Adcare has done better than Adderall on the internal scans, about 85 to 95% on the surface scans, and meets or beats Adderall's performance on the Conners test.